Hello, Clinic Review family. It's Dr. Sharon, and I am here to help you study for Nclex. Are you ready to do that? Let's practice doing some renal urinary questions. Let's get started. Hello, my friends. I hope you're ready to get started doing some renal urinary questions today. You have to know your fundamentals in order to be able to pass questions or pass the Nclex. And so we're going to do some not basic, I wouldn't say they're basic renal questions, but they're pretty fundamental, whether you understand kind of the underlying causes of renal disease. And we're going to do some delegation and some other things. You know that this channel is part of the greater Clinic Review organization, where Mark Klimek himself, the GOAT of Nclex Review, does a 21 plus hour online on-demand Nclex review for your pleasure. You won't regret it. I don't make any money off of that, so I can go ahead and tell you about it. It's high quality, very, very helpful, particularly if you've struggled passing Nclex in the past. I highly recommend it. You can go to clinicreviews.com to sign up for that. We also have an online streaming service. You can find out more about that at clinicreviews.com. And we have small group tutoring where you get 4 tutoring sessions. I teach 2 of those, and we cover next gen questions, which is why we don't do next gen questions here on the channel, because we don't give away for free what we charge for as part of our organization. All right, let's go ahead and get started. These are going to be renal urinary. You know that I don't do a lot of teaching on this channel. I do some teaching, and I teach as we go through the questions, but this is not primarily a lecture channel. Maybe someday, we'll see. Takes me enough time just to do these. So a client with nephrotic syndrome is being monitored at a medical surgical unit. Which symptom is the nurse most concerned about? Significant peripheral edema in the lower extremities, foamy urine, decreased serum albumin levels, acute onset of confusion, and restlessness. Now, when you get a question that says, which symptom are you most concerned about? This is that one prioritization strategy where we're most concerned about the unexpected finding. So remember, you have one patient, all the symptoms are in the answers. They give you a diagnosis. Okay, so a patient, a diagnosis in the question. They say, what are you most concerned about? And all the symptoms are in the answers. You always choose the unexpected finding. That's a rule, y'all. It always works with this type of question. So make sure you know it and you use it when you take your Nclex. So nephrotic syndrome. Nephrotic syndrome is damage to the glomerulus. Glomerulus is the filtration part of the kidney, and it's a single cell layer. And what filters is whatever can fit between those cells. Okay, so nothing goes through the cell, it goes in between the cells. So it has to be small enough to fit between the cell. So when you have damage to glomerulus, what you always see are larger substances in your urine. So you can see protein, okay, and they can also lose albumin. Albumin is a type of protein. So you can see albumin loss in the urine. Foamy urine can indicate protein in the urine. And then edema is a result of the albumin loss. So albumin in the serum holds fluid in the serum, right? And so that's why we're not constantly leaking fluid and we don't have a bunch of edema. So when we lose albumin, which is a protein, we can see edema. So A, B, and C are all expected with nephrotic syndrome. We don't expect confusion and restlessness. And you may say, oh, well, I could have gotten that right without that rule, Dr. Sharon. And you might have been able to. But what I find is on the Nclex, when you're in a high anxiety situation, which is what the Nclex essentially is, it's a high anxiety situation. A lot of times your thinking isn't as clear and you're not as confident in your answers. What I find with people is most often they second guess their answers. People who say fail at maximum number or close to maximum number, 155 is maximum number on Nclex. People who fail close to maximum or at maximum, often they're second guessing their answers. And so what I don't want you to do is second guess your answers. And so if you know the rule, you won't second guess your answers. Which teaching point is most important for the nurse to include when providing discharge education to a client with recurrent UTIs? Stop taking antibiotics when symptoms resolve, increase fluid intake, and void frequently. Use douches regularly to cleanse the vaginal area. Wipe from front to back. From back to front, y'all. I do that sometimes. I misread the answers. Be careful with reading the answers from back to front after urinating. So which teaching point is most important for the nurse to include? Okay, so we're looking for the right thing. So preventing UTIs, what do I know about preventing UTIs? I know that you've got to do good peri area. You need to wipe from front to back. You need to stay hydrated. Those are the main things that I know. Let's see, providing discharge education to a client with recurrent UTI. Stop taking antibiotics. Well, I know you never stop taking the antibiotics when the symptoms resolve. Doesn't matter if it's UTI or not. Like, no, you never do that. So A is out. Increase fluid intake and void frequently. Absolutely. That's good to do. Increase fluid intake and void frequently. Use douches regularly to cleanse the vaginal area. So douches actually get rid of healthy bacteria and flora and fauna. Flora, I think, not fauna. Healthy flora, which is healthy bacteria. Well, hello, Israel. My dog wants attention. So yeah, we don't ever recommend douches anymore. Y'all, I don't know if you're close to my age. On TV when I was a kid, they used to have commercials for Vagisil, which were vaginal douches, and constantly advertising those, and can make you feel cleaner and healthier and happier and all that. And that's the total opposite of what those do. They actually can increase risk of infection. So we don't use douches. Wipe from back to front after urinating. Back to front. Read carefully. I almost read it wrong. You don't wipe from back to front. So I like the increased fluid intake and void frequently. That's what I want to include. A nurse is caring for a client with an indwelling urinary. Charlie, come here. You want to see my dog that's barking? He's the cutest ever. Come here. This is the dog that's barking. Isn't he the cutest? He's the cutest, isn't he? Hi, Charlie. All right, now if you hear him barking, you can say, Charlie, be quiet. This is my newest dog. This is the newest one. He's only about 8 months old. So he's sort of excitable. Yes, he's very excited. Okay. He jumped out of I tried to hold him and he jumped out of my arms the other day, landed on the ground. It sort of surprised him. It didn't hurt him, but it surprised him. So I'm hoping he won't jump out of my arms again anymore when I'm holding him, like standing. He can jump out of my arms when I'm sitting all he wants. A nurse is caring for a client with an indwelling urinary catheter. Which intervention is most effective in reducing the risk of catheter-associated urinary tract infections? Reducing the risk. Administer prophylactic antibiotics. Perform routine bladder irrigation every shift. Encourage adequate fluid intake. Maintain a closed drainage system and ensure dependent drainage. Which intervention is most effective in reducing the risk of catheter-associated urinary tract infections? So whenever it's most effective, it's sort of a best question. Whenever you see a best question and then their interventions, so it's an intervention, right? Nursing interventions, it's a best question. You have to be prepared that you're going to see more than one right answer. So you have to go, I like more than one of these answers. So how am I going to do this? Administer prophylactic antibiotics. Well, that I suppose will work, but we don't do that routinely. So I don't want to choose something as most effective that's not a routine intervention, because best is always some fundamental principle that we have to implement. And administering prophylactic antibiotics is not a fundamental principle. Perform routine bladder irrigation every shift. Again, not a fundamental principle. Do we ever do bladder irrigation? Well, sure, we do it if it's needed, like if it's got sediment that needs to be cleaned out, but we don't do routine bladder irrigation, certainly not regularly. That's not a fundamental principle. Encourage adequate fluid intake. We do that. We want to encourage adequate fluid intake. That does reduce the risk of UTIs. It doesn't necessarily reduce the risk of catheter-associated UTIs. So it is a good intervention to reduce UTIs, but it's not specific to catheter associated. Maintain a closed drainage system and ensure dependent drainage. So we do have to do that. So if we're answering the question that's being asked, it's related to catheter associated UTIs. We want to maintain a closed drainage system and ensure dependent drainage. That is the way you prevent catheter associated UTIs. Maintaining adequate fluid intake is a good way to prevent UTIs in general, but it's not specific to catheter-associated UTIs. And so we're going to answer the question that's being asked, and we're going to pick the answer that is absolutely fundamental to urinary catheters. A client with acute kidney injury is closely monitored for changes. So acute kidney injury is acute renal failure, right? That's essentially what it is. Acute renal failure can be acute. Kidney injury can be associated with what's called pre-renal. Pre-renal has to do with not getting enough blood flow to the kidney. It can be intra-renal, which means there's actual damage to the glomerulus itself. That's nephrotic syndrome would be an example, or post-renal, where the outflow is blocked. So that's like calcium stones, right? Kidney stones. Looks like Israel is back visiting me again. So pre-renal, intrarenal, or post-renal. Okay. A client with acute kidney injury is closely monitored for changes. Which symptom is the nurse most concerned about? Oh, I didn't read the whole question. All right. I need to read the whole question, and that means I'm looking for the unexpected finding. Oliguria, 400 mils, urine output in 24 hours, elevated serum creatinine from baseline 0.9 to 2, complaints of muscle cramps and weakness, peaked T waves on the telemetry monitor. Oliguria, most concerned about. So acute kidney injury. All right. Acute kidney injury. So I'm looking for the unexpected finding. So if they're in acute renal failure, I would expect their urine output to be low. So A is expected, and I would expect their creatinine to go up. That's what acute kidney injury essentially is. Complaints of muscle cramps and weakness. So that bothers me a little bit because it's usually associated with an electrolyte imbalance or peaked T waves on the telemetry monitor. Peak T waves. So that definitely is associated with elevated potassium, right? Potassium hyperkalemia can cause peak T waves. So C is usually associated with electrolyte imbalance, but it is relatively vague, and it could just be sort of a symptom of acute kidney injury. And peak T waves is more specific to potassium imbalance. So I'm going to go ahead and pick D. I'm not sure. I think that's not the best possible question ever, because I think C is a I'd be potentially concerned about C, but D is more specific, and it says most concerned, and D is more specific to the potassium. So I'm going to go ahead and pick that. Which dietary modifications should be included in the plan of care for a patient with chronic kidney disease? So chronic renal failure. Which dietary modification? High protein diet to maintain muscle mass, high potassium diet to prevent hypokalemia, low potassium diet to prevent hyperkalemia, high sodium diet to support fluid imbalance. Which dietary modification would be included? So it's interesting. We have high protein, high potassium, low potassium, high sodium. Now it's interesting because when you see an opposite, it's a single choice option and there's opposite answers. One of them is almost always right because they can't both be right, and it's unlikely they're both wrong. Now it could be that they're both wrong, but it's unlikely. Usually when they're opposites in answers, one of them has to be right. So high protein is wrong because you just keep losing more protein in the urine, and it actually can increase damage to the glomerulus with chronic kidney disease. So we don't want high protein. High potassium, they're prone to elevated electrolytes. They're prone to high calcium, high phosphorus, high potassium because they're not excreting those things in their urine. So we don't want high potassium or high sodium. Both of those things are going to be prone to those. So low potassium is the correct one. A nurse is reviewing laboratory results of a client with nephrotic syndrome. So nephrotic syndrome is essentially renal failure for either genetic. It's often seen in children as a genetic component, and it can be in adults for various reasons from damage due to the kidneys. Which finding is most characteristic of nephrotic syndrome? So nephrotic syndrome is where we lose albumin. There's a lot of swelling. There's protein in the urine, albumin in the urine, low serum albumin, frothy urine or foamy urine. So let's see, protein urea greater than 3.5. So I like that answer. Elevated serum albumin. No, it'd be decreased serum albumin because you're losing it in your urine. Decreased serum cholesterol. I mean, I know proteinuria is the right answer, so I'm not going to pick one I'm not sure about. So I'm not going to pick C, low urine specific gravity. Actually, we'd have a high urine specific gravity because it would be more concentrated because of the kidney, essentially the kidney failure. So we're going to go with the high protein level. An older adult client reports frequent episodes of urge incontinence. Urge incontinence is where you feel like you got to go and you can't hold it. Have you ever seen that commercial? Gotta go, gotta go, gotta go, gotta go. Yeah. All right. I feel like you got to go and you can't hold it. Episodes of urge incontinence. Which intervention is the highest priority to include in the plan of care? Another high priority, this is another best question. So what's the best way to manage urge incontinence? Encourage the use of an indwelling urinary catheter, schedule toileting at regular intervals, and practice pelvic floor exercises, limit fluid intake to 800 mils a day, advise the client to wait until the urge is strong before avoiding. So when you have a highest priority nursing intervention, you never pick an answer that's unusual. There's always exceptions to every rule, but the Nclex tests on general rules, not exceptions for the most part. So when you get a best question or highest priority question, don't pick the answer that you go, well, I might do that. No, pick an answer that's a fundamental principle for treating this issue. So urge incontinence, we don't traditionally use catheters. Absolutely not. We do training, toilet training, regular toileting, and pelvic floor answers. That's fundamental for urge incontinence. We don't limit fluid intake. I can't think of any reason to limit fluid intake that low. Even in heart failure, we don't limit it that low. 2,000 to 3,000 mils a day is the recommended intake for a healthy adult. Advise the client to wait till the urge is strong. Well, no, because you got to go. So we're not going to do that. So remember, highest priority, best intervention is always a fundamental principle that addresses the problem that's presented. The client is admitted with acute pyelonephritis, which symptom would concern the nurse the most. Pyelo is kidney. Itis is inflammation, infection. So this is an inflammation infection of the kidneys. Concern the most is the unexpected finding. So kidney infection, so essentially a UTI that's centered in the kidneys, flank pain and tenderness over the costovertebral angle. Well, that's inflammation, infection in the kidneys, you'd have flank pain. Fever of 101, you have an infection, so you'd expect to have a fever. Urinary urgency and frequency, that's a common symptom of UTI. Dark tea-colored urine with gross hematuria. So we might see darker urine with a UTI, but you don't expect gross hematuria. That's a problem. Gross hematuria doesn't mean it's gross. It means it's a lot. Gross in a medical term means a lot. Okay, that's it. That was pretty straightforward, I think. I hope that was helpful to you. Remember, you answer questions along with me so you learn how to think. You want to learn how to think. You don't want to overthink during the Nclex. When people say, I'm an anxious test taker, what that means is you overthink. Use words like maybe, possibly, could. You got to stop using the words maybe, possibly, and could. You have to just interpret the words that are there. Don't overinterpret it. Don't go, well, if they're having this, it could mean they're having that. No, they have the problem they're presenting, and that's it. Know how to read the questions, right? What's highest priority nursing intervention? Look for a fundamental intervention. If it says, what are you most concerned about? Look for the unexpected findings. So you need to know how to answer the questions, and you'll do just fine. So good luck on your Nclex. Thanks for being a part of the Clinic Review family.